topic that is given to me, that is multi-drug resistant organisms. First of all, let us look at the definition of multi-drug resistant organisms. Multi-drug resistant organisms are organisms that are resistant to 3 or more classes of antimicrobial drugs. Some of the examples are MRSA, methicillin-resistant Staphylococcus aureus, CRE, carbapenem-resistant enterobacteria, BRE, vancomycin-resistant enterococcus, ESBL, extended spectrum beta-lactamases. Now, before I proceed further, I would like to tell you a love story. Now, you would imagine why a love story in a multi-drug resistant organism presentation. But give me a few minutes and you will get to it. Like in every love story, there is a hero and a heroine. So in our love story, the hero is the person and the heroine is the health. And I would like to give it some flavor. I would like some flavor to it and add a Bollywood tadka to it and take it to one of the most romantic Bollywood movies of all time. And let us consider our hero Raj as the person and heroine Simran as health. Now, every love story involves the characters to woo each other. Likewise, in our story also, our hero woos the heroine by lifestyle modifications, medicines, healthy diet, fighting infections, timely visits to doctors, vaccinations, etc. And the hero and heroine fall deeply, madly, truly in love with each other. And the hero showers the heroine with a lot of gifts in the form of antibiotics, medicines, and drugs. And because of which, what happens is when antibiotics are taken longer than needed, or when they are taken even when they are not needed, there arises an enemy in their life in the form of a villain. And that is multi-drug resistant organisms. So if you look at the spread of multi-drug resistant organisms, they spread from patient to patient on the hands of healthcare workers, visitors, family. They can also be spread through contact with contaminated surfaces, objects, and contact with bodily fluids. Now, it is possible that these multi-drug resistant organisms may be present on the body, but they do not cause any illness. For example, Staphylococcus aureus, that is a common bacteria which is found on the skin, on the nose, but not necessarily it can cause an active infection at that moment. So, our hero and heroine, they try to pacify the multi-drug organisms with dancing, mehendi laga ke rakhna. And our MD, the multi-drug resistant organism, respond to it and also say, "Ai meri zohar is abhi," and things go well. But then, from this mellow phase, the bacteria turns into this deadly threat to them, and it is assisted by friends. Previous prolonged use of antibiotics, existing severe illness, underlying diseases like chronic kidney disease, diabetes, long stay in the hospital, patients that are on dialysis, patients that are on catheters like central line, urinary catheters, and repeated admissions in the hospital healthcare system. The elderly, those who are immunocompromised, those who are cancer patients, receiving chemotherapy, previously colonization with MDRO. So they are at risk of developing multi-drug resistant organism infection. So what is our goal? Our goal is that the MDRO finally says to our heroine, "Ja Simran, ji le apni zindagi." And our hero and heroine get their happily ever after. And that can only be possible, it is a long run, and that can only be possible through the help of their friends. That is hand hygiene. We have it displayed all over the hospital in different corners, the 5 moments of hand hygiene, before touching the patient, before aseptic clean procedure, after body fluid exposure risk, after touching the patient, after touching patient surroundings. Judicious use of antibiotics, using antibiotics only when needed and for the shortest time possible. Protective clothing, that is PPEs, gloves, mask whenever is required. Isolation, keeping the MDRO infected patient in an isolated room or with patients that are infected with the same infection. Daily cleaning, all patient care items, equipment, room surfaces are properly cleaned and disinfected every day. Vaccinations, as and when required. monitoring by the hospital and the healthcare system to look for the spread of MDRO infection and take measures to prevent it. And healthcare of our healthcare worker, education of our healthcare workers about the risk of MDRO and the ways to prevent it. So let us give our hero and heroine a happily ever after by with the help of all these measures and reduce the risk of infection spread by multi-drug resistant organisms. Thank you.